chiropractor at Peak Health and Performance. We're an injury and sports rehab clinic in South Central Calgary, Alberta.
I'm Curtis Lochran from Crossfit Above All. We have a CrossFit facility located in South Central Calgary. What we're talking about today is the squat. This is going to be the first video in our video series. What we want to cover today is proper hip hinging and the bony alignment that happens within the hip that can either lead to injury or, better yet, how to best avoid that injury. What we're going to talk about today is a proper hip hinge. To get you to properly hinge your hip, what I actually want you to do is find your hip crease by sticking your bum back and find that groove that starts in at your hip. You're going to take your hand, you're going to start it at that point, and you run it down towards your groin. You're then going to stick your bum back as far as you can. What this does is it brings down your ASIS, your anterior-most, superior-most part of your hip, and it pushes it inside your hip. When done properly, this is going to allow for the back to stay in alignment, but it's going to pull with your hip flexors down to the appropriate squat. When you're doing this, though, there are going to be a few injuries that are associated, typically from that femoral head and that ASIS colliding with some muscle tissue. So, Abby, why don't you talk to me a little bit about what's going on inside the hip when people have pain doing this squat?
Yeah, absolutely. So we all know that different bodies come in different shapes and sizes. So does the bony anatomy of the hip, and so does the tension in certain supportive structures around the hip. So this is a femur. I pulled it out of my left leg. There's a different femoral angle here on certain people. So sometimes it's a little bit steeper or a little bit flatter, and then sometimes it's pretty vertical. This is only the male end of the entire complex. There's also a female end of the complex that receives the femur, now the femoral head. Now, if there's a different angle down this direction or even forwards or backwards of the femoral head, people are going to have to squat with different widths and different rotations of the toes in order to find that pain-free range that Curtis was talking about. Now, if they don't find that pain-free range, you're going to start getting pinching, which we do not want. So we want to stay away from that at all costs. And basically stay away from impingement, away from synovitis, and away from swelling at the hip that can ultimately keep people out of the gym, and that's really what we're trying to stay away from.
Absolutely. So what we're talking about is taking different body types, whether you're a round, curvy person or a really square, boxy person, male versus female, and understanding that not everybody is going to be doing the exact same squat. They're going to be pulling themselves down through their squat appropriately the same way, but everyone's going to have a different heel position, toe out position, and ultimately that squat is going to look a little bit different for everybody.
Yes, absolutely.
So pay attention to our next video series or video, which is going to be covering foot alignment and making that foot into a proper platform so we can create proper knee alignment and get that proper depth of the squat that we're looking for when we CrossFit.